All right, welcome back to ABA exam review and the continuation of our RBT practice question series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out btexamreview.com for all of our study materials, including our combo pack. When you pass, please let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Juwan has a meeting that starts at 9 a.m. every Monday. Juwan is always on time, but he usually has to wait for someone to unlock the door as his team members are always late. Juwan starts to show up late as well, but now his teammates are getting there early and accuse Juwan of being late. If the teammates arriving to the meeting function as reinforcement, what type of reinforcement schedule is most represented? So we're looking at the teammates arriving to the meeting because that arrival is what's functioning as reinforcement. And so we're going to use that to determine the type of reinforcement schedule that is taking place here. So what do we know so far about the scenario? Well, there's a meeting every Monday at 9 a.m. Juwan is on time, but his team members are late. And so if the teammates arriving to the meeting are the reinforcers, then arriving late, Juwan is going to have to wait later than 9 a.m. to get the reinforcement. However, now when he starts to show up late, his teammates get there early. In other words, sometimes his teammates show up late, maybe 9:15, 9:30. Sometimes his teammates show up early, maybe 8:30, 8:45. So the time where Juwan receives reinforcement is always different. So with that said, what type of reinforcement schedule are we looking at? A variable ratio. Does it matter about Juwan's responses here? If Juwan showed up 10 times in the morning, would that matter? No. The only thing that matters is the amount of time that's going by, because the time is what's affecting his teammates' arrival. So variable ratios and fixed ratios aren't what we're looking at here. It doesn't matter what Juwan does. When he shows up, he still needs to wait for his teammates to arrive to get the reinforcement. So the reinforcement schedule we're looking at is either going to be a fixed interval or a variable interval. Well, we know his teammates sometimes get there early, sometimes get there late. So the arrival time is far from fixed, right? It's variable because it's an average, it's unpredictable. Juwan never knows when they're going to show up, but he just knows when he's there, they could be early, they could be late. So his reinforcement is going to come at some point. He just doesn't know when, and it doesn't matter what he does. He just has to sit and wait for time to pass until he can receive reinforcement. So with that said, the type of reinforcement schedule that's most represented is D, a variable interval. Just for fun, you taught your son different types of birds when he was 5 years old. When you went on walks, you would point out the different birds you saw. Now your son is 22 years old and he will still point out birds to you when you're outside hanging out, even though you taught him years ago. What is demonstrated in this scenario? Let's think about the scenario because we're looking at the scenario as a whole and what's being demonstrated. We know you taught your son birds when he was 5. So you'd go on walks, you'd point out different birds. Now your son's 22, so several years have passed, and yet he is still pointing out birds when you're outside hanging out, even though the teaching happened years ago. And so what are we typically thinking about when we taught something and then teaching stops, and then we're looking at that behavior, if it's continuing or not in the future? Well, typically we're talking about A, maintenance. Think about if you need to run a maintenance trial. You might run a skill that you taught a few weeks ago, a few months ago, just to see if the person can still do it. Maintenance is extremely important. Kids with autism and developmental delays, they tend to lose their skills quicker. And so maintenance checks are extremely valuable to make sure they're retaining skills. But think about yourself. What if you learned to play the trumpet when you were 6 and you haven't played in 20 years? Well, odds are your skills will not be as strong as they were when you were 6. It's a lack of maintenance. And so your son being able to still name the birds, even though teaching took place a while ago, is demonstration of maintenance. It isn't overgeneralization B because the behavior is happening at an appropriate time and it's not happening too much. The son isn't overgeneralizing the behavior. And it isn't imitation, right? Imitation occurs immediately after the model. We're looking at the son. He's now 22. still being able to demonstrate the skill that you taught him so many years ago. So, what's being demonstrated in this scenario is A, maintenance. You're tasked with taking momentary time sampling data for a 1 minute sample of 10-second intervals. Target behavior is yawning. You record the following times: 9 seconds, 5 seconds, 8 seconds, 10 seconds, 10 seconds, 9 seconds, 1 second, 8 seconds, 9 seconds, and 3 seconds. How many responses do you know you need to record? Now, what's important here, because we know we're using momentary time sampling, is the length of time of the interval. So we're worried about this 10-second intervals. We're not worried about how long the samples are. We're worried about how long the intervals are. That's typically what's important in sampling and partial and whole interval recording. And so with the momentary time sampling recording, when are we observing the behavior, or when are we collecting the response? Well, we're collecting the response at the end of the interval. So if our interval is 10 seconds, we're going to be recording data at the very end of that interval. So let's look at our times. Right, we have 9 seconds, 5 seconds, 8 seconds. That doesn't tell us anything about what's occurring at the very end of this interval. We know the behavior is occurring, but we're not sure when. However, if the behavior is occurring for 10 seconds, as it is here, then we know the behavior was occurring at the very end of the interval. And so we only have 2 data points here that last 10 seconds. So for sure, how many responses do we know we need to record? Well, it's only going to be 2. Again, momentary time sampling. You're looking at the very end of the interval. Is the behavior happening or is it not? Just knowing that it happened for 9 or 5 or 8 seconds doesn't tell us anything about the behavior and if it's happening or not at the end of the interval. So if the only data points we know for sure, if we're using momentary time sampling, that we would need to record a response would be the 10 and 10-second intervals, these 2 right here. Not an overly complicated question, but it does take a little bit of thought, right? You've got to identify what type of sampling you're using, and then you've got to identify how long the intervals are, and then you've got to think, okay, what am I really measuring here? Just for argument's sake, let's say we were using whole interval measurement. Well, with whole interval, it would have to happen the whole 10 seconds. And so the data would actually be the same because we only have 2 intervals of 10 seconds, right? So again, most important, identify how are you measuring, and then what does your data say? There are several factors we should consider when planning for treatment for our clients. Which of the following factors would be least important if we were trying to pick the most effective treatment for the client? First things first, very important to identify this word least. Well, look, the question is asking about the least important way we would identify the most effective treatment. So don't be confused by that wording, meaning one of these is not going to be a very effective way of picking treatment. And so you've got to put on your behavior analyst hat here because you're going to identify ways that we can plan for treatment for our clients. So let's look at A, the resources we had available. Well, why is that important? We want to deliver treatment that we can deliver consistently and reliably. We don't have the time, the money, the help, or the resources. That's a problem, right? Because we won't be able to deliver it consistently. And consistency is key. And so considering the resources is very, very important when picking treatment. So A is important. B, how convenient the treatment is to us. This is not higher on our list of importance. Now, if given the choice, right, we want treatments that are feasible, okay, that again, that we can do consistently. But just because we're inconvenienced somewhat by a treatment doesn't mean we should or should not pick it. Okay, our convenience as practitioners is not high on the list of importance. What about C? What the parent is willing to do when we are not there. This is incredibly important. Think about some kids who might only receive a few hours a week of therapy. We have all those other hours we're not there where therapy and ABA really should be occurring. And that's going to be the parent's role. And so if the parent is not willing to do the treatment that we've implemented, then maybe we should try something different. We keep coming back to the word consistency because this is what it really is. A consistent treatment is going to be more or less an effective treatment compared to a treatment with no consistency. And then D, is the treatment generalizable? And this is a huge priority, right? It doesn't make a difference if we can change behavior in a controlled clinic environment if that change doesn't generalize. Then what's the point? Because the client isn't going to spend their whole life in that clinic room. Those things we teach need to generalize to new settings. So the generalizability of the treatment is extremely important. So if you were going to pick a treatment, the least important option here is how convenient the treatment is to us, because it's not about us, right? It's about what's most effective for our client. Client dignity should be a priority as ABA practitioners. Which of the following examples would be the least effective way to maintain client dignity? All right, another least effective, least, that key word. Okay, you've got these back to back. You've got to read very carefully. And we're looking for the least effective way to maintain client dignity. And client dignity is very simple, right? You want to show respect to clients and you want to give them the same rights and privileges you would give anybody else. Okay, it means involving them in treatment, not talking as if they weren't there or if they were less than. Client dignity is probably second to our idea of not doing harm. So, of these examples, what would be the least effective way to maintain client dignity? A, when a client is in a room, do not discuss treatment as if they were not there. Would this be something you would want to do? Well, of course, because if they're in the room, we don't want to talk about treatment as if they weren't in the room, right? No matter how old they are, no matter their developmental level, it doesn't matter. You don't talk about them as if they aren't present. So, A would be a good way to maintain client dignity because you're not discussing treatment as if they were not there. B, involving a client in the creation of a skill acquisition plan as much as possible. Absolutely a way to maintain client dignity, involving them in the process itself. Extremely important. Asking their likes, their dislikes, what they want to do, what they prefer. Very, very important. C, use a prior intervention for a current client without conducting a new assessment. Why is this undignified? Well, because this is not treating the client as an individual. And things we do should be individualized to each person. When you work with humans, everybody is different. They have different likes, dislikes, quirks, skills, abilities, behaviors. And so each client deserves their own assessment. D, ask the client what their favorite items are prior to a preference assessment. Absolutely, right? They're the ones who are going to be identifying these stimuli in the assessment. So their opinion absolutely matters when it comes to what they like and don't like. So involvement in treatment, super important. Treating them as if they were just like anybody else, very important, and not talking about them as if they weren't there, right? And so the least effective way out of these options would be going in and using a prior intervention without conducting a new assessment. What you're saying is you don't deserve an individualized plan, and that's never the case. Thank you for watching. Check out btexamreview.com for all of our study materials. When you pass, please let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.